Everyone, welcome back to Heart Health with Michelle. My name is Michelle Routhenstein. I'm a cardiovascular dietitian, and I'm here to help you reduce the risk of heart attacks and strokes using science based nutrition that's metric driven. I want to talk for a second in this video about heart attacks, specifically in women, and how that differs than in men. A lot of the research that we've had in the past was focused so much on men, and it didn't really assess how there's a lot of differences in women, and we have to make sure that it is clear so that we can be more proactive in prevention of heart attacks and also recognizing when a heart attack is happening so that we can have immediate care and also advocate for you to be treated timely and appropriately. One thing that comes up a lot is, the differences between the symptoms in men and women. So, while some may overlap, right? So, that chest pain may happen in both men and women are more likely to experience nausea, shortness of breath, back or jaw pain, or fatigue, and very subtle signs. And this comes because women have more plaque buildup in their small vessels, what we call microvascular disease, which essentially is when the tiny blood vessels in the heart are affected, leading to impaired blood flow. In men, it typically happens in the coronary arteries. So when it happens in the coronary arteries, they're more intensified types of pain. So, super important when you're feeling off, you don't ignore those symptoms and you get checked out. And when you're in the emergency room, if you get dismissed for anxiety or for other things that you know is not right, please speak up for yourself and be very strong in your say, or have your partner or someone who's there with you make sure they realize that they need to advocate for you in this realm as well. I'm going to give you one other tip when it comes to women and heart attacks. If you are taking biotin, I would strongly recommend you stop it because biotin can falsely show, can actually show a false negative results on some of the heart attack lab values. And so you can be dismissed. You could be dismissed when you go to the ER because your labs are not showing that you're having a cardiovascular event. So if you are at risk of a heart attack, or even if you don't know you're at risk, I highly recommend you ditch the biotin supplements because this can be really important in your care if you have a heart attack or symptoms of a heart attack, because if your labs don't show you're having a heart attack, you might be dismissed, be told that maybe it's just anxiety, and that could delay treatment and be really, really scary or dangerous from a mortality perspective too. So just a couple of tips. We need to be advocates for ourselves in the cardiovascular disease space. And this really comes from knowledge of understanding your numbers, where they need to be, not ignoring any symptoms that are different, and really addressing all aspects of cardiovascular well being. Hope this was helpful. Watch my other videos on tips on how to prevent a heart attack, what we can do from science based nutrition to really protect your vascular health. I have many videos. I also have a website, entirelynourished.com, and I have more support in a group setting and one-on-one that you can also find on my website at entirelynourished.com. Ladies, please take care of your heart and be an advocate for yourself. We are not little men, and we have to speak up for ourselves so that we can help diagnose heart attacks sooner and earlier, because that could save your life. Until next time, have a wonderful day.